Hi, this is Larry Bauer, Chief Executive Officer Emeritus. And today I'm with Dr. Len Frommer, a family physician, and I might add, past president of the California Academy of Family Physicians. Currently, he is president for healthcare initiatives of Turner Impact Capital. And Dr. Frommer, Len, is going to share with us how his company works and the ability of his company to invest in healthcare facilities that serve the underserved. Len, thank you so much, and I'm turning it over to you.
Thank you, Larry. Greetings, everybody. It's great to see you through the camera lens. This is going to be a presentation that a few of you may remember from a few years ago. I was able to do a presentation for this group. The numbers have been updated. The strategic mission has been updated, and we get a chance to review what's happened in a good way with our passion about delivering to underserved communities high quality primary care, community serving high quality primary care. So let me just share my screen to get started, and I hope this works and you'll be able to see it. Through the magic of editing, Larry is probably going to make it work and look better than I could. Hang on here. Share screen. Here we go. Okay. And I hope you're seeing my PowerPoint presentation.
Yes. Yes.
Very good. And let me just get it on presentation mode. All right. So I'm going to tell you a story about our company in which our social impact healthcare investment fund lives. The company name is Turner Impact Capital. We started a number of years ago that was founded on the principle that we could apply private market forces to delivering educational, housing, and healthcare services to underserved communities, and do it in a way that would make a meaningful impact on the lives of people in those communities and on the communities themselves. So we got started about 8 years ago. We brought in a fund that we had already, the leaders of our new company in 2014 had already started. And we basically have these three what are called verticals in social impact investing terms. And our founding team is still running things. You see some of the numbers here, millions of square feet of commercial retail experience in the background, adding to that these social impact challenges, and delivering now, as we sit here in 2022, a lot of facility space and infrastructure in the medical world, primary care, community-facing medical world, multifamily housing, affordable rental housing, and charter public school educational facilities. This year, we're on course to pass $3 billion in facility value that we have constructed across the United States. So what is social impact investing really fast? It's a strategy that realizes that you can do good, you can measure change for the better in communities, show with data, solid metrics that you're making a difference, and at the same time, deploy capital that makes money, that has a return, that doing good and doing well are not mutually exclusive, that it's possible to do that. This virtuous cycle, we believe, magnifies, catalyzes in a way that you can't do only with government grant money or with private foundational grant money, that brings to bear market forces that can really scale in growth the things that are needed in communities that struggle so hard to get meaningful access. You see a checklist here of the characterization of the markets we work in, but you know, it's not a mystery to all of us what the struggles are the answer to these struggles is what's been the mystery in our society about the struggle we have with educational quality, particularly in communities of color, quality around affordable rental housing, a struggle that goes on every day in this country, and clearly bringing to bear forces that can really develop great primary care community facing infrastructure to deliver quality care to patients that need it the most. Our approach is that we form these 3 funds. We raise money separately for each fund. The first one, which was inherited when our company Turner Impact Capital was formed, is what we call our Turner Agassiz Charter School Facilities Fund. So in partnership with charter school operators, we develop facilities that are public charter schools in districts where, and neighborhoods where people struggle because there is no school or there is a failing public district school. Our second fund, which started a little after 2014, is our Multifamily Impact Fund. It is, if you would imagine, a fund comprised of campuses of low-rise 2- and 3-story housing campuses, average size about 300 to 500 units, multifamily housing of all ages, affordable rental housing. I'm going to show you in a minute how we do that and how we make ends meet and provide for an environment that's so enriching to the people who live there and making a difference in their communities. And then our third fund, the one we want to focus on, our Healthcare Facilities Fund, just started about 4 years ago. We are in our second version of our facilities fund, Healthcare Facilities Fund. We used up all the capital in Fund 1, and we're on Fund 2 with a big success story in how we built out facilities, and we'll get to that in a few minutes. Let's look at the Charter School Fund. These funds are similar in the models that we use to deliver the goods. No secret, the challenge here is we spend a lot of money on education in this country, more per student than any other country in the world, and our test scores and graduation rates are not where they need to be. You see some of the really painful statistics in front of you. I don't have to repeat them, but I want to point out to you that if you're in a community or in a part of the country where charter schools are controversial, we are not there to replace or compete with public district schools. Our charter school, Turner Agassiz Fund, is there when there is no school that needs to be in a location in an underserved community or a failing school. And you see some of the dire statistics about schools that fail, particularly in minority communities. The opportunity from all of that is what we seized and created a mission and passion to do, which is to build schools with charter school operators, the best of the best charter school operators, that we build schools for them, and that we provide up to 100% of the capital they need to develop the facilities, and then make the return of that capital available back to the investors who invest in our funds through collecting rent in a long-term lease. And that rent is driven by the total project cost in a transparent way, completely open book on looking at all of the construction, all of the hard and soft costs of construction, the purchase of the land, everything thrown into a total project cost turns into what the rent is. And then we provide the triple net lease, long-term triple net lease for those charter school operators to have sustainability and success in their communities while they pay the rent on that total budget basis for what the rent will be. We give each operator an opportunity, each charter school operator, like we do in our healthcare fund, we give the opportunity to purchase the entire project when they're ready, and they can purchase it at the original purchase price from the total project cost, the reverse arithmetic to get to a purchase price, not fair market value. So they get a great opportunity and deal to purchase it with the cost being to get back to the original return to the investors that we've agreed upon with those charter school operators in the original lease. The goal, meeting the goal, the impact of what we've accomplished, over 100 schools have been built through this model. We're on charter school fund number 3 of raising money and then turning it into these facilities with our charter school operating partners. Roughly about 55,000 school seats per year, what would amount to a very large school district if we were one school district of all the various schools across the country that we built. You see the locations there. Key point, 50% of the campuses serve a population where over 75% of the students qualify for free or reduced lunch. That's compared to a national average of 24%. What that means is to qualify for that free or reduced lunch, free rate for those lunches, that it's communities where they're at the lower end of the socioeconomic spectrum. These are communities that are underserved. Matching all 3 of our funds with synergy across our funds, that the neighborhoods are urban dense, racially and ethnically diverse, lower socioeconomic status, and designation by some kind of metric that it is an underserved community. Most notably, as I'll show you in healthcare, and that we're all used to, an underserved community in healthcare would have the designation as a medically underserved area, MUA designation, or a HPSA, health provider shortage area. In the schools fund, we work with the leading charter management organizations in the country. You see some of the names there, but stress the point, the best of the best, achieving great results, great metrics with outcomes on the patients, with graduation rates, school test scores, et cetera, et cetera. Our second fund, the Multifamily Impact Rental Fund, we have a problem in our country of affordable housing. It's not a secret. You see some of the numbers here, people who are spending more than 30% of their income on rent, some people spending more than 50% of the family take-home income on rent. All of the downstream impacts that this results in, and the struggle for low and moderate income earners, teachers, nurses, retail and service workers, municipal workers, they fall in this gap. They make too much to qualify for government housing subsidies, but they're in this big middle where they're not earning enough to afford luxury rental housing or home ownership. So our goal, purchase and operate housing complexes, campuses where the rent is affordable. How do we do that? Well, we have a unique way to achieve this. What we do is we build an enrichment center in each of these facilities that offers programming to all of the residents in that complex for free on everything from after-school tutoring for the students who need it, safety services from law enforcement who lives on the campus, to evening adult education courses, running the gamut, vaccine clinics for healthcare screenings, for blood pressure, diabetes, all of this going on from volunteers who live in the complex and develop the curriculum and deliver the services. How do we get that to happen? Well, they get reduced rent, or sometimes free rent, if they are if the people who live there volunteer to do this, and in exchange develop these services. What is the result? Reduced tenant turnover, increased length of tenancy, and if you're familiar with the multifamily housing world, the largest single cost for a landlord is tenant turnover. So by reducing that, we've cut the expenses so much we can keep rent affordable. That's the basic plan. What's the result, the impact? You see it here. Thousands of housing units in major metropolitan areas that remain affordable. Great place to live. A huge amount of money representing the facilities that we make available and own and operate in many cities around the country. We formed our own internal management, property management operation to take care of these facilities, ensure success in delivering on the mission. And look at that bottom bullet there. Those enrichment centers I talked about have now provided over 160,000 hours of programming. What does it do? 97% tenant satisfaction rate, lease terms with a great increase in time to reduce the overhead cost, tremendous turnaround in the landlord-tenant relationship, and a meaningful drop in the community surrounding these facilities, a meaningful drop in security-related incidents. You know, triple win for sure. So let's talk about healthcare, our baby, our new fund. We started the healthcare fund about 4 years ago. Not a secret here. What's the challenge? We spend more than any country on earth in the history of the human race per person on healthcare. We have a shortage of primary care. We have disparate outcomes, communities that can't afford to get access, particularly to primary care, and we want to turn that around. We want to improve outcomes. We want to improve the patient experience. We want to reduce population health costs. So how do we do this? We created this fund with the mission of addressing the quadruple aim: better outcomes, better access, better patient experience, reduce population cost, and improve the experience of the healthcare teams taking care of the patients in the facilities that we build. That core mission has been achieved across our fund. We have taken the opportunity to build the infrastructure that has designed into it empowering primary care in these underserved communities to work in the facilities that improve patient flow, improve workflow, designed and architected and then constructed with built-in planning, not add-on afterwards, but built-in planning to make the place beautiful and achieve those quadruple aim results. We measure and deliver metrics to our investors every quarter that prove we're making a difference. We do it across provider service lines that run the gamut in primary care, from community health centers in the very qualified health centers in the community health center program, to PACE centers for the frail elderly, to Medicare Advantage focused centers. You see a picture here of a dedicated senior medical center. That building that you see there is actually one that was a closed, dark, out of business pharmacy that we turned into a beautiful healthcare facility. Many more like that. Across our fund, the impact has been profound in the healthcare fund. We have 39 primary care facilities serving over 125,000 patients. We have 8 PACE centers for the frail elderly, which provide wonderful comprehensive medical care and social services, totaling about 2,500 frail elderly participants. If you don't know the PACE program of all-inclusive care for the elderly, please go on the web and do a search. It's a wonderful program. We love it. It's a terrific example of how we do value-based care. One of the elements of our mission is we would do healthcare facilities with providers who rent our space that we build. We would do it with providers who exclusively contracted to provide care in a value-based environment, not a volume fee-for-service-based environment only. So we have the PACE centers, we have community health centers, and you see some of the numbers there and the impact we're making. That was from our first fund, and we built facilities in the states you see listed, and we have now in the middle of raising fund number 2. We expect fund number 2 to be positioned to deliver about $600 million worth of new facilities when we get through that all in the next 5 years. And we'll add many more states. We're coast to coast. That's the impact on healthcare from healthcare. The model is, again, incredibly simple. We work with providers who have a similar mission in serving the underserved in communities that struggle to get access, who want to build primary care facilities that are community facing, not inpatient facilities, outpatient, primary care. We take the total project cost for doing a project, purchase of the land and or building on it. We do ground up or adaptive reuse construction. Either way, we turn the provision of up to 100% of the capital that's needed to do that into a long-term lease. And the rent in the lease is a function of the total project cost, totally transparent budgets, line by line items, completely visible to the healthcare provider organization. We offer purchase options to the organizations who are eager to purchase the facility and turn their rent receipts into mortgage payments. And that purchase price, again, is predetermined by the lease at the beginning, not fair market value. Incredibly simple model. The net result being we can scale operations for providers, whether they're in the community health center world, whether they're in the PACE world, whether they're doing Medicare Advantage exclusively, all common to that value-based payment in those organizations. COVID is a great example of why this is so critical, especially in communities that suffer disparate outcomes because of lack of access. But just take a look at COVID. In the last 4 years, PACE centers for the frail elderly who would otherwise be, if they weren't getting service in a PACE center and living in their own homes, would be in nursing homes. We all know about the incredible tragedy of what happened with patients in nursing homes with the mortality rate from COVID. Nationally, net number, the PACE centers nationally in our country achieved 1/3 the number of deaths from COVID than what happened in nursing homes. So that was a general number for the PACE program, all centers nationally. The PACE centers that we have built, we have 8 of them that I showed you here that are either built or finishing construction, less than 1/3. In one case, we have a number of PACE centers for one PACE operator that we built where they achieved a mortality rate 1/10 the number of deaths that occurred in nursing homes with an equally comparable risk population of patients. These are the kinds of outcomes that we're experiencing with organizing and providing this infrastructure to do this model. I will tell you also, when we track hospitalization rates, rehospitalization rates, emergency room visits, urgent care visits, that everything shows a dramatic improvement, a reduction in the need for acute rescue care at high cost when you provide for wonderful facilities to empower primary care providers to do their thing, to do what they do well, to provide great quality, great value to their patients. So that's the story I wanted to tell. I think Larry has a few questions he wanted to ask me, and then hopefully we'll have time for questions from the audience. Larry?
So I'm going to come back into the picture here. I have a couple questions for you. So I'm wondering, Len, do you want to mention, so when you came to our 2019 meeting, you got into conversations with Dr. Alan Roth and a few others. Do you want to tell them, just to give them some examples of projects that might help people get creative in their thinking?
Sure. So first of all, I want to say thank you to some of the folks who are in the audience who have already submitted some ideas this year. I have received some from folks who saw the announcement that we were going to do this again at the FMEC meeting on the 16th today when you're watching this. The ideas run the gamut, Larry, from different types of service lines, community health centers, teaching centers for model family medicine clinics, integrative care centers. The one you referred to in Alan's case is that we're still trying to get off the ground. We hope we'll get there, but that's an integrative care center offering Western and Eastern philosophy medicine combined for traditional care and alternative care, but a beautiful center in New York City that they want to build, and we can supply the capital to find the site, purchase it, build the facility, and get it open so that his institution can run an integrative care center. We have other opportunities and people submitting ideas for a health campus. Was one of the most interesting ideas that came about in a mid-sized city with a number of acres of land that's available to build kind of a one-stop campus for behavioral health, primary care health, temporary respite housing for the homeless, recuperative care, lots of things going on like that. And nothing is off the table of what kind of idea we can think about and address, as long as the core of it is outpatient care, community facing, with a strong primary care presence.
Tell them where your money comes from.
The investors who invest their money and expect a return, this is not philanthropy. This is an investor saying they want to do well and do good at the same time, and they care about these communities. They care about patients' lives and the community health. Run the gamut from high net worth individuals and families to foundations, to university endowments, banks, you name it. There's a whole lot of different kinds of investors, all with that common mission and purpose of let's make a change. Let's give people access to care that they can't get now. And let's do it in a way where we know we need the most help, which is primary care, and we can build the most infrastructure.
So maybe also you might mention you've now been working at this for a few years. Do you have a favorite project that, or one you think is particularly exciting that you folks have funded in healthcare?
Yeah, there's a number of them, but the ones that stand out in my mind, and we've done 3 of these now, is where a federally qualified community health center decides that they want to open a new community health center in their service area, and they also want to do PACE, and they've never done PACE before. And they come to us and say, we want to do that in the same building. We want to do that next to each other on the same grounds, either way. And we've done a number of these, and they're so wonderful because, as we would expect and know, if you've gone to a group of doctors and teams supporting those doctors for many years, and you're a patient who is getting care through the Community Health Center program in America, you're going to age into Medicare eligibility eventually. And what the community health center organizations have recognized is, as their patients age into Medicare eligibility, many of those patients being Medicaid eligible for the many years they took care of them, they then, when they hit dual eligibility, they have a big freedom of choice to go wherever they want for doctors who accept Medicare, but they were not able to have that freedom of choice when they were Medicaid only. And what those patients often did and do were out migrate from the community health center care, out migrate from that organization. And it was the germ, the genesis of thinking for these CHCs to say, how do we keep those patients? They want to continue to get care with us. They don't want to lose the doctors they know so much. And they came up with the idea of saying, let's add PACE to what we can offer for the patients who qualify for PACE. Most PACE patients are Medicare and Medicaid eligible, and they have some degree of difficulty as they age with the activities of daily living that would qualify them otherwise to be a nursing home patient in the state they live in. And those patients then become patients of this new PACE center. So we build the PACE center, and 2 of them that I'm thinking of are in the same building, where imagine putting a building on a slight hillside, which is what we did. We took over an old car dealership that had closed, and we built this beautiful medical building. It's about 40,000 square feet. And on the first floor, when you walk in on the downhill side of the hill, the first floor is the PACE center. Easy access for the vans bringing the patients in. Patients with mobility problems, you always want to be on the first floor. Works much better. You don't need elevators and things to get people upstairs. But on the uphill side of the property, when you walk in on the ground level, you're walking into the second floor, which is their community health center for younger folks, people who can arrive by car, or the van drops them off if they're being transported to the second floor level. Just a wonderful marriage of the local topography and the design of the building. So that's one of my favorites. But any of them that combine the two, we have another combination where community health centers have decided to go into the Medicare Advantage program heavily and build a isolated standalone Medicare Advantage site. And that's beautiful when you see that for seniors who have a site designed specifically for them.
Great. Well, Len, I'm going to bring things to closure here. And you and I will get a chance to talk offline about how you respond to the proposals that are coming in. And if someone gets inspired hearing this talk now, what's the best way for them to reach you?
Very simple. My email, lfromer, is one M in Fromer, so it's LFROMER at turnerimpact.com. turnerimpact.com. Very simple.
Cool. Len, thank you very much. It's always so much fun to hear you talking, and it's really inspiring about what can be done.
Thank you, Larry. Appreciate the opportunity to present, and thank you all for listening. Hope to hear from you.